So we'll start from here, guys. We have discussed the cataract. We have discussed the classification of cataract based on the location. We have discussed the classification of cataract based upon the causes. Now we will discuss classification of cataract based upon the maturity or staging of cataract. Okay. Based upon the maturity, again, there are some types of cataracts, such as in the initial stages, the cataract which is starting to develop, that is called as an early incipient cataract. In the early incipient cataract, the main feature of the patient is what, guys? There is scattering of light. Due to formation of cataract, the patient will have scattering of light. Okay? Next stage is the immature stage. In the immature cataract stage, what is the patient complaining of? In the immature stage of the cataract, basically cataract looks like, the lens look like a gray color, right? This is called as iris shadow. In the immature stage, you will see gray color of the lens, which is called as iris shadow. Iris shadow. Then the third stage of cataract is called as mature cataract. In the mature cataract, what happens? In the mature cataract, the lens totally becomes opaque. So basically, remember guys, in the early stage, you are seeing scattering of light, which is called as the incipient cataract. Next stage, you will see the gray color of the lens, which is called as iris shadow or immature stage. Third stage is called as the mature stage. In the mature stage, what happens to the cataract? What happens to the lens? The total lens becomes opaque. The total lens becomes opaque. As the lens is becoming opaque, what happens over here is, there will be small pores in the lens. This will open. As the pores of the lens are opened, remember guys, this is the lens. Just in front of the lens, remember first of all, this is the normal lens, guys. This is the normal lens and here is the iris, right? So there will be some space between the iris and lens, which is called as posterior chamber. But in the mature stage of cataract, the lens becomes opaque and the small pores inside the lens, they open up. As these pores are open up, remember guys, this is the iris. As these pores are open up, what will happen? All the aqueous goes inside the lens. The lens absorbs the aqueous inside it, and what will happen to the lens? The lens will bulge. So in the mature stage, you will see bulging of the lens. Bulging of the lens. As the lens is being bulged, what happens to the iris? The iris usually sticks to the lens. And what happens to the posterior chamber? The posterior chamber closes. Okay? This bulging of the lens is called as intumescent. This is called as intumescent. Now guys, look over here. Look over here. As the lens is being bulged and it sticks to the iris, what happens to the posterior chamber? The posterior chamber closes. Look over here, guys. This is the lens. This is the ciliary zonules. This is the ciliary body. Ciliary zonule. Here is the ciliary body. Okay? Pars plana, pars plicata. Okay? So look over here, guys. Look over here. What is happening over here? As the lens is bulging, what happens? From the pars plicata, aqueous is being formed. Now, can the aqueous go outside, guys? Can the aqueous go outside? The aqueous humor can't go outside. If the aqueous humor is not going outside, what will happen now? If the aqueous humor not goes outside, what will happen? This aqueous humor accumulates over here, accumulates over in the posterior chamber. As the posterior chamber is closed, what will happen to the iris now? The pressure in the posterior chamber increases and the iris starts to bulge, and this iris now sticks to the cornea. Now it sticks to the cornea, right? And what happens to the pressure? The pressure increases. As the aqueous is not draining, the intraocular pressure increases. Hence, it leads to what glaucoma? It leads to glaucoma. What's glaucoma, guys? Which glaucoma it leads to? As the iris is bulging, there is a small structure beneath the iris over here which is called as angle. This angle gets closed, hence it leads to angle closure glaucoma. Hence it leads to what, guys? Angle closure glaucoma. I'll repeat it once again, guys, so that you can understand it clearly. We are discussing about what? We are discussing about the staging of cataract. In the staging of cataract, we are discussing about the early incipient stage. So, early incipient stage we have discussed. Then is the immature stage. Then is the mature stage. Immature stage, only iris shadow is seen. Now, look over here, guys. This is the cornea. Okay. This is the cornea. These are the ciliary bodies. Okay. This is the cornea. Here is the sclera. Okay. The second layer is the choroid. Here is the ciliary bodies. Right, guys? Ciliary bodies gives rise to ciliary zonules, which is holding the lens. And now in front of the lens is the iris. This is the normal person. Normal person's eye. Now look over here. What happens? In the mature stage of the cataract, this lens absorbs, this lens pores open. If the pores of the lens opens, what will happen now, guys? If the lens pores are open, what will happen now? Now, what will happen to the lens? This lens absorbs the aqueous humor and this lens bulges. As it is bulging, what happens? The iris sticks to the lens. As the iris is sticking to the lens, the posterior chamber closes, the pressure inside the posterior chamber increases. You will see bulging of the iris, which is called as iris bombi. And due to this bulging of the iris, the angle gets closed over here. Hence, it leads to what glaucoma? Angle closure glaucoma. So, mature cataract can cause glaucoma. Mature cataract can cause glaucoma. Which glaucoma it can cause? It can cause angle closure glaucoma. So, guys, we are discussing about, we'll start from here. We are discussing about the stage of cataract, which is called as mature cataract. So, we have already discussed what is intumescent and all, right? Guys, due to this intumescent, it is leading to what glaucoma? Angle closure glaucoma. It leads to angle closure glaucoma, and such a glaucoma that is occurring due to change in the shape of the lens is called as a phacomorphic glaucoma. It's called as what glaucoma, guys? Phacomorphic glaucoma. Phacomorphic glaucoma. So remember, guys, intumescent. You can write there in your notes. We are discussing about what? We are discussing about the mature cataract. The whole lens is opaque and you will see intumescent. Intumescent is what? Lens absorbs the water and bulges, sticking to the iris, Hence, the posterior chamber is also closed. Hence, posterior chamber is closed. Hence, posterior chamber is closed. That can cause iris bombi, leading to what? Leading to glaucoma. Which glaucoma? ACG. What is ACG? Angle closure glaucoma, and this is also called as phacomorphic glaucoma. Phacomorphic glaucoma. I hope everyone understood over here due to intumescent. So this was happening in what stage of the cataract? The mature stage. The last stage of the cataract is called as hypermature. Hypermature mein what is happening, guys? As the lens is bulging and all, but lens bulges to an extent. What happens after some time? After mature stage is being passed, after some days the lens goes into the hypermature stage. In the hypermature stage, what happens? Suddenly the lens bursts out. Suddenly the lens bursts out. Burst out means what? It will release all the water out, right? So remember, in hypermature cataract, the lens loses all the water, but the water which is inside the lens, that is being lost. Apart from that, lens is made up of crystalline proteins, yes or no? That crystalline proteins are also lost from the lens. So what happens in the hypermature stage? Remember, in mature stage, the lens was becoming bulged like this. Okay? In hypermature stage, the lens loses out all the water. It loses out all the water. As the lens is losing out all the water, what happens, guys? The lens becomes thin. The lens becomes thin. And again, now it has lost out all the water. The water as well as what is being lost. The water as well as what is being lost, guys. I'll just draw this is the ciliary body, ciliary zonule. The lens looks like this. Okay? This is the iris. It is basically not sticking to the iris also now. It has basically moved away from the iris. So as the lens is losing out all the water, the proteins are also lost from the lens. So what will happen? All the water and the protein goes from the posterior chamber through the pupil into the anterior chamber. In the anterior chamber, it goes into the angle. Okay? And from the angle, it goes into the trabecular meshwork. Trabecular meshwork only allows the water or the aqueous humor to go. What happens to the protein over here? The protein gets clogged over here. And due to this clogging of the protein, what happens? The trabecular meshwork gets blocked. And what will happen to the flow, guys? Can the aqueous humor flow? No. If the aqueous humor is not flowing, what will happen to the aqueous humor? Pressure increases. Yani ki intraocular pressure again increases. Again the patient will develop what? Glaucoma. But how is the angle? Angle is open. So this causes, remember guys, in hypermature cataract, as the proteins are blocking the trabecular meshwork, the patient lands up into what glaucoma? Patient lands up into open angle glaucoma, which is also called as phacolytic glaucoma. Which is also called as what, guys? Phacolytic glaucoma. Phacolytic meaning what? The lens breaks down, leaving all the water and the proteins from the angle into the trabecular meshwork. The trabecular meshwork blocks, leads to what glaucoma? Phacolytic glaucoma. Phacolytic glaucoma. So remember guys, we are discussing about what? We are discussing about the hypermature stage of the cataract. In the hypermature stage, now you have to write what? The lens now loses all the water as well as protein. The lens now loses all the water as well as protein, right? Which goes to the angle, from the angle it goes to the trabecular meshwork. But what happens in the trabecular meshwork? This is the trabecular meshwork. What happens in the trabecular meshwork? The protein blocks the trabecular meshwork. The protein means lens protein, crystalline protein, blocks the trabecular meshwork. Hence leading to glaucoma. What glaucoma? Hence leading to open angle glaucoma, which is also called as what glaucoma? Phacolytic glaucoma. It is also called as phacolytic glaucoma. Okay. So remember guys, in hypermature cataract, the lens becomes shaky with dancing of the lens. The lens becomes thin. That dancing of the lens is called as phacodynesis, right? It leads to phacolytic glaucoma. And due to this, remember one thing it can lead to is phacolytic glaucoma. Other thing is what? Due to this lens losing out its protein and all, what happens to the lens? The lens can be moved from its normal position. So this can also lead to subluxation and dislocation of the lens. So remember guys, this hypermature cataract is further divided into two categories, which is called as Morgagnian and sclerotic cataract. Morgagnian and sclerotic cataract. ठीक है. Morgagnian is what, guys? Morgagnian means lens becomes milky white in color. Sclerotic means lens become hard in color. Hard in color means lens becomes hard in consistency, right? So guys, we have discussed about the stages of cataract, in which we have discussed the, we'll start from here. We have discussed the early incipient stage, where you are seeing what? Scattering of light. Then we have seen what stage, guys? We have seen the immature stage, where you see the iris shadow. Then you see the mature stage, where you see the intumescent, right? Where you see the intumescent. Then we came into the hypermature stage, where you see what? Phacolytic. So mature stage leads to intumescent and phacomorphic glaucoma. Hypermature stage leads to phacolytic glaucoma, right? Hypermature is further divided into Morgagnian and sclerotic cataract. Morgagnian means lens become liquefied, looks like a milk. Okay? What I told you, basically lens become liquefied, looks like a milk. It leads to what glaucoma, guys? It can lead to glaucoma. Okay? Next, sclerotic. Sclerotic is the hardest type of cataract. The second hardest is the brunescent cataract. So remember, guys, this hypermature stage is further divided into two things. The hypermature is further divided into Morgagnian and sclerotic. So we were discussing about the stages of cataract. The last stage is the hypermature stage. In the hypermature stage, there could be two masses seen. Either it can become a Morgagnian or either it can become sclerotic. Morgagnian means a milky white cataract. Sclerotic means it becomes very hard cataract. Okay, right? If it becomes sclerotic, then it can lead to subluxation. Subluxation means dislocation of the lens from the normal position. Okay. So this was regarding what? This was regarding the staging of cataract. So we have discussed the early incipient stage, immature, mature and hypermature stage. Okay. Now guys, sometimes in some individuals, there could be pre-senile cataract. It is not a different form. Pre-senile meaning what? Before the age of 45, the patient might develop cataract. So cataract developing in less than 45 or 50-year-old is called as pre-senile cataract. It could be seen due to some underlying disorders such as Down syndrome or Christmas tree or atopic cataract. Christmas tree means what, guys? Christmas tree means if the patient is having Wilson's disease, right? So this was regarding the staging of cataract, the early incipient, mature, hypermature and the early incipient, immature, mature and hypermature cataract. Okay. So this was regarding the staging of cataract. Now guys, we'll come to the next cataract. Symptoms of cataract. Right. Now we'll start with the symptoms of cataract. So staging we have done. Symptoms of cataract. What is the main complaint of the patient when he is having cataract? The main symptom of the patient is what, guys? Main symptom of the patient is slow, painless loss of vision. There won't be any pain. Patient will be telling that, doctor, I'm not able to see the things properly. Slow, painless loss of vision, right? Apart from slow, painless loss of vision, patient will also complain of polyopia. What is polyopia, guys? Polyopia is multiple images of a single object, multiple vision of a single object. Imagine there is one pen, I am telling that I am able to see some 3 to 4 pens, even though it is one. That is perception of multiple images of a single thing is called as polyopia. Patient complains of painless loss of vision. Patient will have polyopia. Some patient complains of colored halos around the light. Some of the patient will tell what, guys? As they are seeing bright light, they will see what? They will tell what? There is some vibrant light colors. Vibrant means what? Rainbow-like colors surrounding the bright light. That scattering of the light around the bright light is called as colored halos. The patient complains of colored halos. The patient will also complain of xanthopsia. What is xanthopsia? Xanthopsia is yellow vision. Why the patient complains of yellow vision? Remember, guys, first of all, what are the symptoms of cataract? Patient complains of slow, painless loss of vision, polyopia. Patient will complain of what? Colored halos around the light, and patient complains of xanthopsia. Why the patient complains of xanthopsia? Why? Because this patient has lost the ability to perceive the blue color. Okay? As he is not able to perceive the blue color properly, everything appears to be yellowish to him. Everything appears to be yellowish to him. Okay? So, after, remember, during cataract, the patient complains of xanthopsia, and due to this feature, if you do surgery in this patient and if you place an intraocular lens, if you remove the cataract lens and place a new intraocular lens, immediately after surgery, the patient complains of what? Synopsia. Yani ki what is synopsia? Now he will tell what? Everything is appearing to be bluish to me. Why? Why? Because this patient when he was suffering with cataract, he had lost the ability to perceive the blue color. He was complaining of xanthopsia. Surgery is done. Now his eyes are totally normal. Lens is totally normal. Now normal blue color is also appearing very bright to him. So that is called as synopsia. So after surgery, he complains of synopsia. During cataract, he complains of xanthopsia. So patient complains of painless loss of vision, polyopia, colored halo, xanthopsia, and after surgery, patient complains of what, guys? Synopsia. Why synopsia? Why? Because he was not able to appreciate the blue color while he was suffering with cataract. He was not able to appreciate it. Hence, he was complaining of what? Synopsia after the surgery. Okay. So, this is regarding what, guys? This is regarding the symptoms of cataract. How will you diagnose a patient of cataract? Any patient who complains, come to my OP with a complaint of, sir, I'm not able to see the things properly, or I'm having polyopia, or whenever I'm seeing a bright light, I'm seeing some rainbow-like colors surrounding the bright light. That is called as colored halos or xanthopsia. I will take the patient to an instrument which is called a slit lamp. I'll make the patient sit in front of slit lamp. I'll examine his patient's eye. When I examine the patient's eye, I'll see what? I'll see the cataract. I'll see the opacification. Normally, when you see the patient's eye, whenever the patient is having cataract, normally without a slit lamp also you can say that he is having cataract. But to differentiate what form of cataract, what staging of cataract, you have to make the patient sit in front of the slit lamp and you have to examine the patient's eye. That is called as what, guys? Slit lamp examination. Apart from slit lamp examination, you also go for tonometry. Come on, guys, why do you go for tonometry? As we know, cataract can cause glaucoma, intraocular pressure can be high. So, to measure intraocular pressure, you can go for tonometry. You can also go for gonioscopy. What is this gonioscopy? Sir, tonometry we have discussed. What is this gonioscopy? Gonioscopy is an instrumentation that is used to measure the angle. Why? Because I told you, mature cataract can lead to phacomorphic glaucoma, that is open, that is what glaucoma? Angle closure glaucoma. Whereas hypermature leads to what, guys? Angle closure. Hypermature leads to open angle glaucoma. Okay? To view whether it is open angle or close angle, you go for gonioscopy. Gonioscopy is an instrument that is used to measure the angle. So remember, guys, mature leads to what glaucoma? Angle closure. Hypermature leads to what glaucoma? Open angle. Why mature leads to angle closure? Why? Because mature cataract, you will see bulging of the lens, closing of the iris, closing of the angle. Okay. So we go for slit lamp examination. We can also use an ophthalmoscope. Apart from that, what are the other instruments that could be used? This examination is called as slit lamp examination, guys. Okay. Apart from that, what else we can use? Gonioscopy can be done, tonometry can be done, and a color vision testing can also be done over here. Why color vision testing? Why? Because the patient is not able to appreciate the what color? Blue color. That's why he is complaining of xanthopsia. You guys know color vision testing and all, right? What are the testing charts done? ISHRS chart, FM100U test, Nagel's anemaloscope. Those are the tests that are usually done for checking the color vision. Okay. So anyways, guys, after examining the patient and diagnosing that this person is suffering with cataract, what should be your aim? In 10-15 years back, if I ask you this question 15 to 20 years back, and if I ask you, how will you manage cataract? What would be your answer? 15 or 20 years back, sir, cataract is there, lens is opacified, patient is having some problem, I will give glasses to the patient. But now this is not the answer. The right answer is what? The main management or management modality of cataract is what, guys? Surgery. Surgery meaning what? Remove the cataract lens, remove the opaque lens and place a normal intraocular lens. The main motto of the surgery is what, guys? Remove the opaque lens and place the intraocular lens. Okay? Place a new intraocular lens. So remember, guys, 15 years back, the first surgery, remember, guys, the 15 years, in cataract management, you are having two options, glasses and surgery. Glasses was the older option. Nowadays, the new option for cataract is what, guys? It is surgery. In olden days, the first surgery that came into the market was ICCE. What is this ICCE full form, guys? ICCE means intracapsular cataract extraction. Intracapsular cataract extraction. What is this meaning of intracapsular cataract extraction? 15 years back when this surgery came into the market, what we were doing at that time? When surgery was introduced, first we were giving glasses to the patient. Then we went to this surgery called as ICCE. What we did? We gave an incision on the capsule. We removed the lens as well as the capsule. In intracapsular cataract extraction, you give a 10 mm incision. First, you give a 10 mm incision on the sclerocorneal junction. What is the sclerocorneal junction called as? The junction between sclera and cornea is called as what? Come on, guys. The junction between sclera and cornea is called as what? It is called as limbus. It is called as limbus. So look over here. Imagine this is the junction. Okay? Cornea and sclera junction is called as limbus. Okay? So we used to give a 10 mm incision. We used to open from here. We used to give a 10 mm incision. After opening from here, what we used to do? We used to remove the lens as well as the capsule. As we were removing the lens as well as the capsule, the patient was developing what complication? He was without lens. He was becoming aphakic. Aphakic patient means what? Will he remember, guys, if you are removing the lens, how many diopters are lost from the eye? 17 diopters are lost from the eye. Can the patient look at the near things properly? No near things properly, no accommodation. After doing this ICCE, we used to give some thick glasses to the patient so that he can view the near things and all. So this was the surgery done 15 years back, called as what? ICCE, intracapsular cataract extraction, where you used to give how many mm incision? 10 mm incision at the sclerocorneal junction, create a tunnel over there, and then with the help of cryo and with the help of cryo probe and with the help of forceps, you were removing the lens as well as capsule. But this was coming with a complication. What complication? Patient was without lens. After the surgery, patient becomes aphakic. He's not having cataract, but as well as what? He's also not having lens. So are we using this ICCE? No, sir. Nowadays, we are going for what? ECCE. What is ECCE? Extracapsular cataract extraction. Now, guys, what is this extracapsular cataract extraction? It is very simple, guys. Extracapsular cataract extraction meaning what? You give a small incision. Small incision means what? 8 mm incision at the sclerocorneal junction. The sclerocorneal junction. We open the junction. Again, we take the forceps. Again, length and keratometry, axial length and keratometry. Then we place the intraocular lens, right? So remember, guys, ECCE meaning what? Extracapsular cataract extraction. An 8 mm incision is given on the sclerocorneal junction or at the limbus. Intraocular. Surgeons become more sophisticated. They are thinking now what? Instead of giving that much of incision, we give a small incisional. Now, the next surgery that came after ECCE was small incisional cataract surgery, SICS, okay? Where they gave incision of 6 to 6.5 mm. Okay? After giving the incision, they remove the lens and they place an intraocular lens. But after this small incisional also, again the surgeons became more sophisticated, thinking like 6 mm is also very high. We'll go for a more small incision. Then they came up with the next surgery, which is called as what, guys? Phacoemulsification. Phacoemulsification. So after ECCE plus PCIOL, the surgeon became more sophisticated. They went into the SICS. What is SICS? Small incisional cataract surgery, where they used to give a 6 to 6.5 mm incision on the sclerocorneal junction, and then they used to remove the lens from that junction. Okay? But after SICS was also having complications. So surgeons, what they taught? Instead of SICS, we'll go for a more small incisional surgery, which is called as phacoemulsification. Phacoemulsification, you are giving incision less than 3 mm at the limbus. As you give the incision, now in phacoemulsification, you introduce a probe that will smash the lens at 40,000 times per second. Lens will be smashed. All the lens matter will be sucked out, and then you will place an IOL. Now, while placing a normal IOL, you will find a difficulty over here. Why? Because the normal IOL can easily go through an incisional site of 8 mm or incisional site of 6 mm. In phacoemulsification, you are giving a 3 mm incision. Your IOL cannot be fit. So what you will do? Now what surgeons did? The surgeons, they prepared a foldable or a rollable IOL, which is made up of acrylic or silicone, and then they placed into the patient's eye. Nowadays, phacoemulsification is regarded as the best surgery for cataract. Why? Because the length of incision is very small, hence the healing is very fast. Second, you are using what lens? Foldable or rollable lens. Okay, that is phacoemulsification. Nowadays, recently introduced, there is one more surgery which is called as micro-incisional cataract surgery, which is also called as MICS. Here the length of incision is 2 to 2.4 mm. So nowadays we are also going for micro-incisional cataract surgery. But remember guys, ECCE plus PCIOL is the most commonly used surgery for what cataract? For mature and hypermature cataract. For mature and hypermature cataract. Whereas phacoemulsification is the surgery which is usually done when the patient is arriving in the early stages, such as in the immature stages. Okay. So once again guys, the best management for cataract is what guys? Is it the glasses or the surgery? The best management for cataract is always the surgery. Always the surgery. In the surgery, I told you what are the surgeries or what are the surgical options available. We are having an option of ICC, we are having an option of ECC, we are having an option of SICS, and we are having an option of phacoemulsification and microincisional. Remember guys, ICC is it done nowadays? It's not at all done. It's only done if there is any subluxation or dislocation of the lens. If the lens is being dislocated from the side, you give an incision and you place it in a normal position by ICCE. ICCE is not done for cataract nowadays, okay? Why? Because here the length of incision, what you are giving? 10 mm. Second reason, in ICCE, you will remove what? Capsule as well as lens. So remember guys, ICCE is intracapsular cataract extraction. The length of incision in ICCE is how much? 10 mm. That's the length of incision in ICCE, right? It is only indicated for subluxated or dislocated lens. In ICCE, what are we removing? Here the two things are removed together. The lens as well as the capsule. The lens as well as the capsule both are removed. Okay? In ICCE, you are removing the lens as well as the capsule. That is regarding what? ICCE. Is it done? Not, sir. So remember guys, in ICCE, we give 10 mm incision on the limbus. Then with the help of cryo and forceps, we remove the lens as well as capsule. Lens as well as capsule. Hence, are we using this, guys? We are not using this. Okay? Why? Because what's the most common complication with ICCE? The patient becomes permanently aphakic. Okay? The patient becomes permanently aphakic. The most common complication is aphakia. What is aphakia? Aphakia is absence of lens. So, we are not using ICCE. Nowadays, we are using what? ECCE. ECCE. So, ICCE is only used for subluxation and dislocation. ECCE is used for what, guys? It is used for mature and hypermature cataract. It is used for mature and hypermature cataract. Hypermature cataract. ECCE full form is what, guys? ECCE full form is extracapsular cataract extraction. Extracapsular cataract extraction. That is called as ECCE. ECCE. So remember guys, extracapsular cataract extraction. Here we will go for ECCE plus PCIOL. Here in ECCE, how much is the incision that we are giving? We give 8 mm incision on the limbus. We give 8 mm incision on the limbus. Okay? Then we give an incision on the capsule and we remove the cataract lens. Once the cataract lens is being removed, we have to replace the lens with a normal intraocular lens. But before placing an IOL, this is very important, guys. Two things has to be done. You have to check the axial length and keratometry, right? Here the length of incision is 8 mm, right? So ECCE is plus PCIOL is the most commonly done surgery for cataract. This IOL, intraocular lens that you are replacing into the patient's eye, it is made up of PMMA. What is PMMA, guys? Polymethyl methacrylate. Polymethyl methacrylate. And what is the best site for implantation of the lens? Obviously, it is a capsular bag. You are removing the lens from the capsule, so you have to place in the capsule only. So, the best site for implanting the lens is the capsular bag. While doing the surgery, you have to irrigate also. You are using some irrigating fluid in order to maintain the intraocular pressure and all. What is the irrigating fluid that you use? That irrigating fluid is the basic salt solution and glutathione. The basic salt solution and glutathione. This was also asked, guys. While doing the surgery, what is the irrigating fluid that is being used? That is basic salt solution and glutathione. Next, after ECCE and PCIOL, the next surgery is SICS. What is SICS? Small incisional cataract surgery. Here the length of incision is 6 to 6.5 mm. Okay? as the length of incision is a bit low, it will heal within time. You don't have to require any treatment for healing and all, right? But the major disadvantage of it's what, guys? The patient will develop wound astigmatism, wound related astigmatism. You guys remember what is astigmatism? No, sir. Why you don't remember? Why? Because we don't know what is astigmatism. We have not discussed astigmatism. Remember, guys, again, for astigmatism, again, imagine this is the cornea, this is the lens, and here is the retina. Normally, the light rays should focus on the retina. The light rays should focus on the retina. That is the normal rule. Okay? This is the normal rule. If the light rays focuses behind the retina, that is hypermetropia. If the light rays focuses before the retina, that is called as myopia. Okay? Astigmatism meaning what? Two different foci of light rays are being focusing. One is focusing on the retina. One can be focusing either in front of retina or either behind the retina. That is called as astigmatism. Two different foci of light rays. Okay. So remember, guys, we are discussing about SICS, small incisional cataract surgery, right? The length of incision is 6 to 6.5 mm, right? But the major disadvantage is what? The patient might develop wound-induced astigmatism. Wound-induced astigmatism, okay? Next is what, guys? Phacoemulsification. Phacoemulsification meaning what? Phacoemulsification, here the length of incision is less than 3 mm or it is 3 mm. The length of incision is 3 mm. After taking an incision, you introduce a phaco probe that will smash the lens at what? You introduce a phaco probe, a metallic probe that hits the lens at 40,000 times per second and smashes the lens. Once the lens is being smashed out, remember, guys, how much is the length of incision that you have given over here? 3 mm. Can you put a normal IOL? No, sir. What IOL we need to put? We need to put a foldable or rollable IOL which is made up of acrylic and silicone. So even after doing phacoemulsification, we have to give glasses for the near vision. But remember, this is a surgery which will give you maximum visual rehabilitation. Meaning what? After surgery, the patient's vision improves very early. When you compare it with the other surgeries, phaco gives you maximal visual rehabilitation. Okay. Next, but the disadvantage of phaco is what? Again, mild to moderate wound astigmatism can be seen with phaco. Wound astigmatism is also seen in small incisional cataract surgery. It is also seen in phacoemulsification. But nowadays, the surgery which is recently introduced is micro-incisional cataract surgery. We'll discuss that later. Now, guys, remember, phaco is done for what surgery? This is very, very important. Okay? ICC is done for what surgery? ICC is done for dislocation and subluxation of the lens. Dislocation and subluxation of the lens. ECC is done for mature and hypermature cataract. Phaco is done for immature cataract. Phaco is done for what cataract? Immature cataract. Okay? These are the surgeries which are commonly used for the different stages of the cataract. The last surgery is micro-incisional cataract surgery. In micro-incisional, the length of incision is how much? 2 to 2.5 mm. Right? The advantage is what? There is no astigmatism associated with this surgery. There is no wound-related astigmatism associated with this surgery. That is called as micro-incisional cataract surgery. So once again, guys, the surgeries that are done for cataract is ICC done? Answer is no, sir. ICC is done for only subluxation dislocation. ECC and PCIOL, yes, it is done for mature and hypermature stages of the cataract. Okay? Next. It can be done, but wound-related astigmatism, 6 to 6.5 mm incision. The length of incision in phaco is 3 mm, but again, wound-related astigmatism can be seen. Last is micro-incisional cataract surgery, where the length of incision is 2 to 2.5 mm, where there is no astigmatism. So this was the cataract surgeries. Okay. Now, guys, we'll discuss about the complications of cataract. But before going to the complications of cataract, just look over here, guys. How many types of IOL are there? The intraocular lens that you are replacing in the patient's eye. Before, once again, guys, there is an important MCQ over here. Before placing an IOL, what is the investigation done? Investigation done before IOL placement is what investigation, guys? What is that investigation called as? You look for axial length and keratometry. You look for axial length and keratometry. So, anyways, guys, what are the three types of IOL? IOL, we are having monofocal IOL, multifocal IOL and accommodative IOL. It totally depends on what the patient is suffering with. So, I was telling you about the IOLs. We can use monofocal IOL, multifocal IOL or accommodative IOL. It totally depends on what the patient is having. If the patient is having some myopia, hypermetropia or something, then accordingly we use the IOL. Okay. So anyways, guys, this was regarding what? This was regarding the cataract surgery.